I'm Paul Newman. My day job is as Chief Executive of Greensleeves Care, which is a not-for-profit care provider in England. We have just under 30 homes for older people. And I'm also chair of the BSI committee for aging societies, working also at ISO level, delivering standards for older people. So today I wanted to really start with a quote from the American demographer, Frank Notestein. Next slide, please. Frank, back in 1954, he said, "Viewed as a whole, the problem of aging is no problem at all. It is only the pessimistic way of looking at a great triumph of civilization." And yet, now almost 70 years later, many people still view our aging society in a negative light. Changing the perception of aging is vital to ensure that all of us can continue leading fulfilling lives within our communities until we are no longer around. Lives where age is never a barrier to empowerment and independence. So as well as reimagining care, I think we need to go deeper and start reimagining people's perception of aging. Rebecca talked about her experience in Japan, and I was going to highlight that as well. I think to achieve this vision of reimagined care in the community, developed nations need to broaden the provision of models of care available. We need more options that help us live independently for as long as possible. Taking Japan, they have the world's highest proportion of over 65s. They make up for, I think it's 29% of the total population. So a significant, almost a third of people within Japan. These sheer numbers no doubt influence the development of a community-based integrated care system that was introduced in 2006. It's a widely acclaimed approach and due to be fully implemented by 2025. And what it does, it enables older people to continue living in their communities while receiving long-term care. Unsurprisingly, its success relies on integrating social and medical support through a range of well-connected local services. The Japanese system also enables people living with dementia to continue living and thriving in familiar communities while still receiving long-term care. If you look at that Japanese system as a pioneering example, I can't help but reflect on the enormous opportunities for collaboration between care providers who are experienced in delivering high-quality person-centered care and housing developers who can embrace the principles of universal design in the new multi-generational communities they build. I think another good example is the Nordic region. They're paving the way by increasing inclusivity for older people in society. The Nordic Welfare Centre is at the forefront of developing age-friendly cities and communities, and I know they're keen to be involved in Ian's standard. And what this involves is improving housing, transport, social participation, community support, and health service. It's very much a whole system approach. As I mentioned earlier, I'm chief exec of a care charity, and I have the pleasure of leading a workforce who understand intimately that caring for people in a care home setting crucially involves supporting their independence. And I believe that care homes have a key role in driving urban regeneration with universal design, accessibility, and assistive technologies at their heart. And just to give you an example of a new home within the Greensleeves Care family, we're opening a residential and nursing home in South London called the Meadowcroft in a couple of months' time, just before Christmas. The home is part of a much larger development that includes new homes, a school, and large-scale renovations to an existing hospital. The Meadowcroft Care Home was designed from the outset to be nested within that new community. Its front door is steps away from flats aimed at young people and families. None of this is by accident. It's all designed to promote multi-generational connection and belonging. The recent pandemic has shone a light on the fragility of care systems around the world. If that wasn't difficult enough, the increase in social isolation has been referred to as a pandemic in and of itself. Studies have shown that loneliness, particularly in older people, impacts both mental and physical health. So it's ever more pertinent to focus on our social well-being. This is why at Greensleeves we're keen to establish our care homes as community hubs, porous community assets, which foster meaningful connections both for our residents and for neighbours living locally, particularly those at risk of social isolation. Residents across all our care homes are supported and encouraged to go into the local area, have new and fulfilling experiences, and make connections with their neighbours. At the end of the day, we're all different. We can expect we will all age in unique and different ways. I firmly believe that the care options we design today must offer a broad choice of products and services that reflect the many ways in which people age. And most importantly, they must celebrate and empower us along the way. Many thanks. I think there's just a couple more slides. The next slide highlights the work at ISO and at the BSI that we've been undertaking for the last 4 years or so. Anybody who wants to get involved, please contact your national standards body. And also on the final slide, there's a link to get involved specifically with Ian's work through the Agile Aging Alliance. Thanks very much for your time.
Thank you very much for inviting me to be part of this panel. This is a hugely important topic, and I'm delighted that these conversations are happening. As I said at the start, my background is in health and social care. And over the years, I have worked on countless improvement initiatives to improve the quality of care in care homes. And there has been a huge focus on care homes in recent years, especially since the pandemic. And this can only be a good thing, don't get me wrong, I think it's long overdue. But I think that we have been missing a trick. As we all know in this room, we don't choose to move into a care home. And given the current staffing crisis in social care, if we carry on as we are, that we simply won't have the number of care home places we need to meet the demand in I think, the very near future. So we need to look at alternatives, and that's what I was awarded a Churchill Fellowship to do in 2019, which was to look at different models of housing with care. And I went to New Zealand and Japan, which are countries both known for innovation in the sector. And I'd like to spend a little bit of time thinking, telling you a little bit about what I learnt on my travels. Sorry, my voice is going. Okay. Sorry about that. So in New Zealand, I was focused solely on the retirement village model. And I know retirement villages get a bit of a bad press in this country, and they are unaffordable to most. But in New Zealand, they're very much considered much more part of the norm, and there's a much broader range of provision for people on different budgets. And there's much better regulation of the sector and protection for residents. There are many advantages to retirement village residents in terms of health and well-being. They have a social life on tap. They have the opportunity to get involved in a whole range of different activities. And I think, as we've been hearing previously today, they tend to form informal support networks. They check in on each other and look out for each other. Now, people do move into retirement villages at a younger age, and they don't have the same health and care needs of people in care homes. But there is some emerging evidence to suggest that they are less likely to need to move into care homes in their very old age. But retirement villages are not for everyone, and we've heard that earlier today, and they have been criticised for segregating older people, warehousing older people, and cutting them off from their communities. So thinking a bit more about multi-generational communities, in Japan, the examples I visited were much more integrated within their neighbourhoods and within their communities. And the places I visited in Japan tended to be designed for people with higher health and social care needs. So there was more of a direct comparison with the cohort of people who live in care homes in this country. Now, the way they achieved this integration was by opening up their facilities for use by the wider public. And the key thing I noticed across many of the places that I visited was that these facilities were well designed, they were attractive, they were places that people wanted to come to. And they could be things like leisure facilities, restaurants, cafes, a gym, a wellness centre. And they were, definitely things that were needed by the local community. To talk about one specific example that I think really sort of stuck with me, I went to visit a housing with care facility for people with dementia on the outskirts of Tokyo called Ginmokusei, which means Silverwood. Now, Ginmokusei had its own restaurant on site. It was this beautiful glass-fronted building that literally sort of jutted out onto the pavement. It was unmissable as you walk past. And it was open every lunchtime for members of the community. Residents had the opportunity to work in the restaurant, and it served good quality food at reasonable prices in very comfortable, relaxed, and stylish surroundings. And I think, needless to say, it was packed on the day that I visited. Residents also opened up a tuck shop on site and attracted in the local school children on their way home from school. There were no locked doors in this place, and it was designed very much with community interaction in mind. So there's loads more I could say about Japan in particular, but I know I've only got a few minutes. In conclusion, I think, I think we're all saying, aren't we? There's an urgent need to develop alternatives to care homes. I think we've heard about a whole range of different examples out there. I think we just need to get on with it. I think having a standard for multi-generational neighbourhoods could really, and to include this as a sort of recommendation, I think could do a huge amount to alleviate the pressures on social care, but also create more choice and opportunities for, I'm not going to say older people, I'm going to say us. Thank you.
Good afternoon. So in preparing for today, I was thinking, or have been thinking about, how do we plan communities to enable people, this word enable people to be and do what they want and what they value for as long as they can. And I think that's the really important thing, for as long as they can. I'm going to take over this. There we go. So people are living for longer, which is great. That's a fantastic thing. Linda Grattan and Andrew Scott from the LBS have studied the impact of living longer, and you may or may not be familiar with the 100-year life concept study that they've been looking at, and they've also actually written a book as well. And I think there's a lot of things that came out of that were really interesting. First of all, the 3 stages that we traditionally take for granted, study, work, and retirement, are changing and perhaps are no longer actually relevant. We will need to work longer to support our longer lives. We'll need to have money unless we've inherited a huge fortune or won the lottery. And the career that we have in our 20s is not the same career necessarily we're going to have in our 40s or even in our 60s. I'm on my 2nd career, and there's maybe still room for another one. So that it's all changing. But the other thing which I think was really interesting within that study is that beyond work and money, there are a number of intangible assets that people require to actually have a good, productive life. Things like family, friends, love. The love doesn't ever go away. It continues all the way, even as we get older. And of course, health and experiences. And experiences, extraordinary experiences that lift our spirit and give us confidence. So how do we create an environment that will enable a good, productive life, especially as we get older? The concept of the 15-minute city, the 15-minute neighborhood, the 20-minute district, you've heard these terms being thrown around a lot, especially post-COVID. In many ways, the 15-minute neighborhood has existed for centuries. The ability to live and work and have access to amenities within walking distance is not a new thing, especially before the car came along. People had to have access to all of these things that they had in their lives by walking or by horse. But now in the 21st century, the things that we require are slightly different. There's a shift. Of course, we still need the shops and we still need a doctor, of course. But it's a gym, it's a cinema, it's a coffee shop. It's neighborhood parks, which became incredibly important during the COVID pandemic, and a community hub in some physical or virtual form. But key to this is if you place all of these amenities in a walkable neighborhood, people will interact. They will build relationships, and they will support one another. And again, that came through during the COVID pandemic. I'm clicking, it's not moving. There we go. This was a new district master plan that I worked on for about 5 years down in Portsmouth on the south coast with Portsmouth City Council. So it became my second home after 5 years. And the ambition was to create a self-sufficient place where people of all ages would live, and ideally where someone could live a full life cycle. So you would come in as maybe a student, rent some accommodation, buy your first apartment, buy your family home, and then maybe downsize into a smaller accommodation as you became an older adult. Excuse me. The other key thing about this was that it was a supported place. So based on the idea of the 15-minute neighborhood, the district had a wide range of amenities, pretty much all the things I was just talking about a minute ago, but it included outdoor spaces and parks, places where people could meet for exercise and leisure activities, and even allotments for the residents to grow their own healthy food. Again, one of the key things that we were thinking about when we were developing this district, as well as accessibility and being inclusive and creating this very strong community, was mental and physical well-being, which was one of the key drivers when we were designing it. And in addition to that, it was a smart place as well. And we came up with this idea of an app that would provide connected services so that everybody would be connected and could be serviced, whatever their needs were within the community. It was obviously an inclusive place, and we developed a wide variety of homes to suit different ages and scale of houses as well. But perhaps the most differentiating thing about Lennox Point was the concept was based on a pedestrian's first approach with the introduction of this idea we came up with of the living street. And basically the streets were prioritized for walking, cycling, wheelchairs, prams, anything that wasn't a car, essentially. And we deliberately placed homes fronting onto the street to encourage community integration and support and helping to reduce loneliness and isolation. So this was obviously, in terms of our strategy, one of the key things was to ensure that people of all ages felt that they were part of that community and could, even if they were living by themselves, could have access to different groups and different types of people, depending where they lived. So in quick conclusion, because I hear the bell, proper community planning with the right approach can ensure that people of all ages are enabled to live as they want for as long as they want, which is fundamental. Thank you.
And Portsmouth happened or not?
It is currently on hold, under review with the local politicians.
It's another conversation, isn't it? What do you think could be done to catalyze the market?
To get it delivered. It's an interesting question, and I was thinking the same thing, actually, because there obviously are situations that block the delivery of such schemes. And a lot of it is driven, first of all, is there an appetite politically? And that has to be reflected in policy at a central and a local level. And then one of the key factors that comes onto the table when you're trying to really break into a whole new area of, particularly when you're thinking of new communities and how you want them to look and feel and work, is the cost of value. Our feeling when we create something, and there's a lot of thought went into Lennox Point. It's an incredible concept. Our feeling is that in itself creates so much value, both in terms of social value, but also monetary value if developers want to get their heads around it. But invariably, before you get to that stage, there's always a conversation about cost, the initial outlay, the funding. And I think that's an area perhaps where an adjustment in thinking would really be beneficial as well.
Hi, everyone. I'm Stephanie Firestone. I'm an urban planner by training and have worked with local governments and national government and nonprofit sector my entire career on sustainability and aging. I work at AARP, which is largest nonpartisan nonprofit organization in the U.S. dedicated to enabling people to live as they want as they age, and empowering them to do so. And I work on livable communities issues as part of the Global Thought Leadership team. AARP has been collaborating with AAA for some time. In December 2019, as Ian said, we convened a leaders forum in London that what emerged was, I don't know if you can put up the slides that I sent, but what emerged was this set of guiding principles for built environment professionals, which was mentioned earlier as a key document behind the SMN Code of Conduct work, and included in AAA's latest publication, Cultivating Neighborhoods That Care. AARP has an Equity by Design initiative that has since the development of the principles engaged built environment professionals from around the world in global conversations and elicited some proactive findings. I'll just share a few of them from this set of principles. One is around enabling design. I was very happy to hear Mr. Hurorf use the term enabling homes. Housing's been built the same way for so long that people can really only envision a narrow range of products. So among the things that we as built environment professionals need to do are demonstrate innovations in that space and then drive informed consumer demand for a variety of housing options. In the technology space, we need to move from smart cities or using technology for efficiency to more thoughtful cities where we do things like democratizing data. I was very pleased to hear this discussed today, and integrating residents into those processes, which includes building the capacity among community members to contribute their perceptions and their preferences as part of those data, all in order to achieve more equitable outcomes. And we need to alleviate disparities. Housing in many cities around the world we know is just not affordable. Though the UN has declared housing is a basic human right. In fact, a new report by the UN independent expert cites as the top barrier to autonomy and independence in relation to housing the lack of adapted and diversified housing options. Next slide, please. So for the last 1.5 years, we've been spotlighting innovations that are moving the needle on these guiding principles. And here is one relevant example on the next slide, please. Most cities and communities around the world don't have sufficient public restrooms. Those that are available are often uninviting, don't accommodate people with a variety of needs. And many older people actually reduce their participation in society, leave their homes less frequently because they fear not being able to access adequate restroom facilities. And this can reinforce isolation, as we know. So this case study and webinar, which included the founder of the World Toilet Organization, that's the genie in this picture, tackled numerous aspects of this challenge, including the need for culture change, often using humor to break through people's discomfort and to just normalize the conversations about human waste. Next slide, please. So all of these case studies and webinar recordings are on our webpage. This one is about universities as age-friendly partners that occurred yesterday. The next one on December 6th is about LGBTQ plus affirming housing for older people, including a toolkit for housing developers. Next slide, please. And an important principle in that first slide that I didn't yet mention, but want to focus on, is that our living environments have to facilitate intergenerational engagement, which is a big part of our reason for serving on the working group to create the ISO standard on multi-generational neighborhoods. To figure out how to advance policy in this space, we at AARP wanted to learn how people feel about living in multi-generational households. You can find all the findings from this research at the site that's listed on the bottom of this page. We partnered with Culture Intel, which is a data analytics company that uses artificial intelligence and other tools to scrape open source digital discussions. So these data are harvested from spontaneous conversations, not a survey, which always has the risk of introducing bias. We mined nearly 100 million conversations about multi-generational households in English, Spanish, and Chinese, the bulk in the year prior to the pandemic, February 2019 through February 2020. And then again from March through June 2020, that's what we call mid-COVID, because who knew COVID would last this long? So I want to share with you just one of our findings in the next couple of slides. Can you advance, please? So this question breaks down perceptions by 4 geographic regions with overall positive in green, neutral in gray, and negative in red. On the question of how people feel about living in a multi-generational household, this was pre-COVID. So you can see by the most positive attitudes are among people living in Latin America at 50%, followed by Asia at 38%, with the US and Europe at about the same in the low 30s, and a very equal representation across all regions of negative sentiments. Next slide, please. By mid-COVID, again, that period that we called mid-COVID, the first 5 months of this pandemic, the positive sentiment shrunk by almost 1/3, with a dramatic and equal shift happening in the US and Europe. The neutral sentiment in these 2 regions didn't change much. So essentially, the positive sentiment from before COVID jumped straight to negative sentiment, which we believe was fueled by the many pandemic stressors, as well as by new people coming into the conversations during the pandemic who may have had to move into a multi-generational household or done so involuntarily. And note that in the last 2 regions, the positive sentiment changed only slightly, decreasing in 6% in Latin America and actually increasing in Asia by 2 percentage points. If you find this interesting and may want to partner with us to revisit these sentiments in the post-COVID era, please contact me. That is something that we're looking at. Next slide, please. So my final note is that we've already taken one important step to advocate for multi-generational living. We created a new section for it in AARP's policy book, which comes out every 2 years and serves as the guide for all of our offices' policy advocacy work at the state and local levels, as well as at the federal level, and the global level too, because we do operate, work with the UN on ratifying and all kinds of infusing aging lens in all kinds of agreements, international agreements. And so that's in each of our 50 states, the U.S. territories, and then again, globally. Thank you.
We're going to go to the live stream audience for our question here.
Can you share with the watching audience in terms of some of the examples from New Zealand and Japan that you saw in terms of the alternatives to care homes? And then a second question, which touches on what Stephanie said around sort of attitudes pre and during COVID to multi-generational homes, is will incentivising families to help look after older generations help become part of tackling the social care issues?
I saw so many. I've visited, I think, in total about 18 different facilities, but I'll be brief. In New Zealand, I was looking at the retirement village model, and I know it's not a direct alternative to care homes because you're looking at sort of different groups of people, but I think the point was that actually if people who live in retirement villages, and if they move in at a younger, older age, they are less likely to need either to move into a care home or to need a sort of heavy or intensive care and support package when they're very old. Basically, they're supported to stay healthier and active and more socially connected for longer. So that was the sort of, I guess, an alternative in a way. Japan, there were so many different initiatives. The one I talked about was housing with care. I mean, similar to kind of extra care housing that we have here, if you're familiar with that. But extra care housing here is really only for people on benefits or housing benefit, whereas in Japan it was much more for a private market. So people have their own front door of their little apartment, but they have a care staff do provide support. There were things called small group homes for people with dementia. So about, I think, 8 to 9 people live in one home together, and it's very much based on looking at what people can do to contribute to the running of that home. Take charge for the laundry, help with the meal prep, that kind of thing. And then other really quite innovative models of having a sort of centralised hub within a community which had maybe 6 beds. But they have a membership model of about 30 people, and if someone is feeling a bit wobbly or having a bit of a crisis, they can move in to that hub and stay in one of the rooms for, I don't know, a week, get their confidence back, and then go back out again. But they had so much more to offer than just the rooms. There was a sort of lunch club, outreach services. I'm going to stop there, but I think you get the idea. I wrote a report.
And there's a really good article in the report that I think there might still be a few around. And for those online, you can download it via our website that you wrote about that experience. Stephanie, you can answer the second question, please.
Sure. So there are some really good models of incentivizing people to live with or near older adult relatives. In Singapore, they have some direct funding from the government. I think it's to the tune of $20,000 for someone to buy an apartment where they will live with their older adult relative, and even something like $10,000 to buy an apartment where they will live within 4 kilometers of their older adult relative. So there is clearly a recognition that it is a financial incentive to the government to have people in the family who can take care of their older adult relatives. Some places in the U.S., some states, we deal with this in with remote and rural areas where in many countries, younger people are moving into the city and abandoning those areas. Those areas are aging at a faster rate. And so we have some states providing moving incentives for younger people to move back to those states, to those areas. It's not necessarily directly connected with moving, being close to their own relatives, but it's certainly connected to being close to older people. And I think there's a lot of room for growth in that space.
Paul, my question to you is, you have an article in this report where you have a wonderful picture of one of your care homes with the, I think it's a combination of staff and residents saying it's outstanding. Why did they say it was outstanding? What did you do to make that experience outstanding?
It's a number of things, Ian. It's about person-centered care being at the heart of everything you do. It's about providing a responsive and effective service that meets the needs of the individual resident, and it is very much about treating people as individuals, an ethos of dignity and respect, and always recognizing that no matter how well you are doing, you can always do better, and striving consistently to embed a quality improvement ethos within that, not even home, within that care setting. You know, my forte might be care homes, but care now is delivered through so many different settings, and that's a good thing, because people need to be given choice, and if you give people choice and respond to their preferences, that will drive outstanding care in whatever setting somebody chooses to receive it.